Last night, Bill Moyer's Journal had an excellent fact-based expose on single-payer healthcare insurance. Some clips are used to illustrate the realities behind why we must have such a system. President Obama understands that the state of our healthcare insurance system will bankrupt the country and individuals within. In fact, he understood that single-payer insurance was the only way out back in 2003.
I happen to be a proponent of a single-payer universal health care plan. We may not get there immediately, because first we've got to take back the White House, and we've got to take back the Senate, and we've got to take back the House.
President Obama has gotten his wish. He has the presidency, a filibuster-proof Senate, the House of Representatives, very high popularity, and a country that polls 60% in favor of universal health care.
I tell people, I always ask them to tell me if they understand single payer and what it's all about. It's a great idea from the left, which is public financing, combined with a great idea from the right, which is private delivery. And you put it together in one system that takes out the waste and the abuse that's really happening, which is where all the money goes into the health insurance. Up to 30% of the costs have nothing to do with health care.
It's what we used to call national health insurance. So government collects the money for health care from taxes. You don't pay premiums, instead you pay taxes, and pays all the bills. Hospitals remain privately owned and operated. Doctors remain mostly in private practice, but their bills go to the government insurance program, just as they do today with Medicare. But we'd be able to streamline the payment system if we had only one payer instead of Medicare being one among many. So a hospital would get paid like a fire department does today. You have one check a month that pays for the entire operation, and that means you can eliminate the huge billing apparatus of the hospitals and the doctors' offices where we're employing many people to do our billing and fighting with insurance companies. You save $400 billion a year that way.
It is mathematically irrefutable that single-payer healthcare insurance is the least expensive and most efficient way to pay for healthcare. As illustrated, its only cost is the administration of the program, which, using Medicare numbers, would be under 3%. Private insurance, as illustrated, has a myriad of costs associated with it. With Democrats in complete control of the government, one would expect that passing single-payer healthcare insurance would be a slam dunk. This is not the case, as Democrats are showing extraordinary timidity towards the insurance industry attack.
The industry is pouring big money into lobbying, more than $500 million last year alone, according to the nonpartisan Center for Responsive Politics. They're also shelling out megabucks for a publicity blitz and ads attacking Obama's public plan or any health care reform that threatens to reduce the profits from sickness and disease.
With Congress starting on health care, let's remind the politicians, Americans know what works.
This is from a group calling themselves Conservatives for Patients' Rights. They've been spending more than $1 million on ads like this in the month of May alone. They've hired a conservative public relations firm called CRC. You remember CRC, the same high-minded folks who brought you the Swift Boat Veterans for Truth, the gang who savaged John Kerry's service record in Vietnam. Just who runs Conservatives for Patients' Rights?
Let's have real reform that puts patients first.
The guy in the ads. His name is Richard L. Scott, an entrepreneur who took over 2 hospitals in Texas and built the largest health care chain in the world, Columbia HCA. In 1997, Scott was fired by the board of directors after the company was caught ripping off the feds and state governments for hundreds of millions of dollars in bogus Medicare and Medicaid payments. It was the largest such fraud in history. The company had to cough up $1.7 billion to get out of the mess. Scott got off, you should pardon the expression, scot-free. According to published reports, he waltzed away with a $10 million severance deal and $300 million worth of stock. So much for lower overhead.
Many Americans falsely believe they have excellent healthcare insurance and fall prey to the misleading advertising done by those opposing single-payer healthcare insurance. They do this at their own peril.
But if you get sick, you find out just how inadequate that insurance may be. And I tell people, not only did I have health insurance, I had Aflac disability insurance and a healthcare savings account on top of that. So we were like the prime example of responsible people who try and keep ourselves covered. And yet when we got sick, There was no way. The deductibles and out-of-pocket maximum exposure added up so quickly that we were buried very quickly financially.
Well, people are satisfied many times with their doctor and with the hospitals they go to, and most Americans aren't sick and don't actually have experience of their health insurance. But when you get sick and actually have to use your insurance, that's when people find out the dark side of the policies. They have huge co-payments, huge deductibles. We did a survey of people filing for bankruptcy in courts around the country. Half of the bankruptcies are medical bankruptcies in this country, and of those medical bankruptcies, 3/4 of those people had insurance, at least when they first got sick. But people have insurance that goes away after they actually need it.
One definition of insanity is doing something exactly the same and expecting a different result. Private for-profit insurance has been a complete failure specifically because its sole purpose is to provide profits for investors. It adds no value to any service provided.
People want to find a solution that they can get through without a big fight with the insurance industry. Unfortunately, it's economically and medically nonsensical. You can't actually have a health care program that works if you keep the insurance industry alive.
We have got a fragmented health insurance industry, and it thrives on being fragmented. The drug companies make much more money with the fragmentation because there's no price control. The insurance companies make much more money because they can push away people who aren't going to be profitable. The only people that suffer are the patients. Over the last 30+ years, there have been maybe 2.5, 3 times more doctors and nurses, pretty much in proportion with the growth of the population. There are 30 times more health administrators. These people are not doctors, they're not nurses, they're not pharmacists, they're not providing care. Many of them are being paid to deny care. So they are fighting with the doctors, with the hospitals to see how few bills can be paid. That's how the insurance industry thrives, by denying care, paying as little out as it can, getting the healthiest patients and yet getting reimbursed as though these patients were sicker than they really are. So it's a system that is guaranteed to waste a lot of money, and what we've said is that the amount of money that's just being wasted in 1 year is enough to pay for more than enough of the premiums for those that are uninsured and the people that are underinsured. So it's not a matter of bringing more money in. I mean, the industry is now saying we could save $2 trillion over the next 10 years. Let us, trust us, we will lower our costs and everything. The amount that could be saved over the next 10 years by just eliminating the health insurance industry is $4 trillion in one fell swoop.
Many opponents of single-payer healthcare tend to use Canada as a proxy for single-payer failure. Proponents of single-payer must call their bluff on this issue and provide real case studies as well as live random interviews with Canadians, which will inevitably show great support for their healthcare policy.
What do you say to the argument, though, of people who've gone to Canada and looked at that system? Well, there are long waiting lines. You can't choose your doctor. In fact, conservative critics say this will lead to what they dread, which is socialized medicine. Would single payer, in fact, mean I could not choose my doctor?
Well, in Canada, actually, you can go to any doctor, any hospital in the country.
Much more choice than here.
Yeah, Canadians have better choice than we do. They spend half as much per person on health care as we do, and if you're going to cut our budget by 50%, we'd have to have some waiting lines. But if we're willing to keep spending at our current levels, we could cover everybody with first dollar coverage with terrific access to care.
What do you mean first dollar coverage?
No co-payment, no deductible. You go to the doctor, the whole bill is paid. Any doctor, any hospital in the country, that's the model. And that's not just me who says that. The Congressional Budget Office has said that in the past. The Government Accountability Office says we're spending enough to do that. And we're really talking about social insurance, like Medicare is social insurance, but doctors and hospitals remaining privately owned.
With single payer, the benefits would be publicly financed, as you just said, but that the health care providers would, for the most part, remain private?
They certainly would, as would the hospitals.
They wouldn't work for the state.
No, no.
They wouldn't get their salaries from the
In fact,
government.
private practice is more common in Canada than it is here in the U.S. And in the U.S., we're seeing more practices being taken over by big corporations and people, basically doctors, becoming employees of large bureaucracies. In Canada, private practices remain the norm, and that's what we're saying ought to continue in the U.S.